This is a special edition of Late Night Health. I'm Mark Alyn. We're going to talk about dentistry, but a special kind of dentistry, Facelift Dentistry with Dr. Sam Muslin, S-M-U-S-L-I-N. He's based in Santa Monica, California, and people literally come from around the world to see him. Dr. Muslin, thanks for joining us here on Late Night Health.
My pleasure. Thanks for having me.
I'm really curious about something. Why do people seem to hate dentists? And you seem to be a nice guy. You're charming to talk to. But people don't like dentists, do they?
Well, what happens is look at all your choices. When you go to a dentist, they're numbing you, or they're drilling, or they're replacing a crown, or something like that. And that's just what I call traditional patch-the-hole dentistry. And then suddenly, with porcelain veneers, we can now have a better smile, but that doesn't do anything for our health. So the reason that they come is I've developed a method where your healthy teeth don't need to be drilled down. If you're a mother and your son has an underbite, he doesn't have to have jaw surgery, even though every dentist you go to tells you he needs jaw surgery. And if you have an underbite and a small-looking chin and they tell you need years of braces and jaw surgery, we can take care of an underbite in a matter of days with this method.
Oh, my. What about braces and things like that? Do we need braces? I remember wearing them. They hurt like hell.
Well, people that wear braces, and I treated my patients with braces for nearly 20 years. So I've done that. I've done the neuromuscular dentistry. I've done the full mouth reconstructions, done the gum surgeries, all of that, the implants, and so my career has spanned 40 years. I've bought every technology and done everything. And I felt that, the reason that we feel the way we feel about dentistry is that it's not a pleasant experience versus today. I had, like as an example, I can treat people without even giving them a shot because it's a revolutionary way of looking at how someone should be treated. So can I give you an example?
Absolutely.
A physician and his daughter flew in from another state. His daughter just had her braces taken off. And when they took the braces off, it was almost like her face fell in. Her nose is sticking out, her chin is sticking out, and when she talked, you couldn't see any teeth. And the orthodontist did what orthodontists do. They make teeth straight. But they don't get the jaw in the position, the mechanical position that you're meant to have, and that's the issue. Most of us are not in the most ideal position, and the ones that are look younger than everybody else and stay younger looking. They sleep better, they breathe better because their jaw is in the position, its natural position, versus this young lady. She was in an unnatural position. The dentist did what he did. He got her teeth straight. That's what orthodontists do. But the secret to health is getting the jaw in the right position. And I was able to do that by correcting her bite, first locate the position, and then adding porcelain to her teeth without drilling them down, without giving her a shot. She has a whole new level of facial support, a better-looking jaw, lips are fuller, you see teeth when she smiles, pick your color. You can have whiter teeth if your teeth are gray. And that's revolutionary. I mean, that nobody in the world knows about this. And that's why the ones that find out about it, they fly in, they bring their children in. I've even done a family of 4 this last July.
Oh, my goodness. And you're working on your own family as well.
Well, what's interesting is my daughter is a good example. Let's say she's about 38-ish, somewhere in that age bracket. And over the years, she's had teeth that were small, but she had a good jawline, and she's functioning normally. But over the years, her back teeth have worn down. So I would say having 2 grandkids probably made her clench and grind more. I'm not sure. She's wearing a night guard, but it didn't do it. Her overbite started to get deeper, and her teeth were wearing, and she's clenching and grinding, so we decided to give her the jaw position she was always meant to have, and we're doing that by adding to her teeth. So we don't have to grind down. Her teeth are short. We just build right over the top. She'll have a new face, a new shape to her face, better lip support, a new jaw position, and she'll breathe and sleep better. It's healthcare with cosmetic benefits.
You know, it's interesting because a lot of people realize that gut health, which starts in the mouth, is the root of all health. Would you agree with that?
Well, the first level is no infection. And so many of us, the patients, when they come in and I see them on the first visit, they really don't know how to floss well, and they don't brush and get all the areas well. The brushing technique's not so good, and they're not using a water flosser. And so what I do with my patients is the first thing we do is we start off with a method that's very quick. They can floss their teeth, brush their gum line, and water pick afterwards. It's less than a minute to floss, less than a minute to brush the way I train you, and less than a minute to water pick your whole mouth, and you do that just before you go to bed so that all night while you're sleeping, your mouth can be healing rather than getting worse.
One of the things that I remember, from years ago, I think we're about the same age, and is that, the dentist would hand you a brush, or the hygienist would hand you a brush and say, brush. And you'd scrub like you were scrubbing the bathroom floor.
What's evolved is that I have in-your-mouth cameras. So when you sit in the chair, I pick up my camera. I don't deliver any bad news. I let the picture deliver the bad news, if there is any. And so a lot of times it becomes sort of like a stock tip. Well, look, Mr. Jones, this is the area you're missing. We want you to brush this area because you're right-handed and you're not getting the inside of your right side. You're getting your left side well because you're right-handed, but not. So I coach them, and I help them see what's infected. You see that red. You see the gum is swollen. Do you see this white line going along here? That's the Great Wall of China with the white blood cells all lined up trying to hold your infection back that you're swallowing, and it's in your bloodstream every minute of every day. So my first level of treatment is absolutely the highest standard of gum and mouth health possible.
And I was just thinking, we've interviewed the CEO of the Alzheimer's Foundation, and he says if you're right-handed, every now and then switch off and brush with your left hand.
It's a great suggestion.
Right? Not only for your mind, but for your mouth too?
Well, the thing is you need to get the brush half on the gum and half on the teeth. And, whether you switch hands every so often, which there's nothing, that's fine to do. The key thing is is your technique good enough to where you can do it quickly and you can do it effectively, and there is no infection in your mouth. The shape of your gums is perfect. They don't bleed really easily. They're not swollen. Look at the horror movies. Every time they have a horror movie person, they always swell up the gums and make the gums bloody looking and nasty. That's the first level of horror movies. So I want all my patients to have thin, streamlined gum with the texture of an orange rather than the texture of Jell-O.
I just ate a beautiful orange from my own tree in the backyard. Let's talk about lips. You said that if you have the procedure, that your lips actually look better. Today, a lot of people, a lot of women that is, particularly, are having cosmetics done to their lips, and they make them so big. To me, personally, they're not attractive at all.
I would agree with that. And now with this method, they don't have to do it. So instead of, and plus I've also found, I've seen patients that have done it for years, and after a while the lips sometimes start getting bumpy. And because you're stretching this tissue and you're putting this material in. So I find that a lot of patients have thin lips because the teeth behind the lips are not at the best angle and they're too short. And so they've worn their teeth down, which is very typical of, let's call it, my age group, and our jaw lines are shrinking.
And we should point out that the doctor who's been practicing for 40 years started, he was only 6 years old. So.
Yeah, that's for sure. I think I saw my first dentist at 6. But the point of it is when we're living decades longer. So when I started practicing 40 years ago, most patients died between 60 and 70, and today it's 90 and 100.
Right.
And when you live those last 30 years and your teeth are wearing down, it has a profound effect on your face and your sleeping and breathing ability.
One of the things that a lot of dentists are doing is TMJ and also sleep apnea treatments. After your treatment, after you're redoing somebody's mouth, do they sleep better and snore less?
The patients tell me that it's different for each one, but what happens is this. When your jaw is pushed back towards your throat because you have an overbite, your airway is going to be a little smaller. It's going to be smaller. You're not going to breathe as well. When your teeth wear down, there's not room for your tongue in there, and so you're going to snore and have sleep apnea and a lot more problems. And so there are devices that you can wear, and there's a CPAP that you can put on your nose, but the point of it is some patients want more than just that. They want to look younger. They want to feel younger. They want natural-looking teeth. And the way to get that is getting the jaw in the position it was always meant to be, rather than a jaw that's pushed back towards your throat with an overbite, making it look smaller than it really is. So it really becomes but do the patients tell me they're sleeping better? Yes. Do they tell me they're breathing better? Yes. But the main thing is there's a smile on their face because physically they are feeling better. The head and neck tension from a bad jaw position is gone.
One of the things that is very popular right now are tooth implants, or even, there are places that say come in at 8 and you leave at 4 and you have a new set of teeth. I can't imagine the pain in that. Can you talk to us now about implants and your thoughts on implants?
Well, I can tell you that implants work very well. And the nice thing about it is you don't have to have removable teeth. Now, what you mentioned, the implants and the teeth, that's a denture that snaps onto the implants. Let's put that topic aside for now, and let's take the person that had to have a tooth extracted. What are they going to do? And they can now have an implant put in their jaw and a tooth built on it, and it chews naturally. It's never hot and cold sensitive. It doesn't decay. Implants work well if they're done by someone that's really good at it, and you're using a brand name implant rather than so many of the much less expensive types where the companies go out of business and 10 years later you're having trouble getting parts.
They have parts for it. Implants require parts. I have to remember that. It would seem to me that it would be better to have a single implant rather than all, 24 teeth? I don't remember how many teeth we have.
It depends on how much bone you have. And so you cannot have an implant unless you have enough bone. If you've lost all your teeth and you have bone in just this front area, you could have 2 implants and your denture could snap to that. But most of the cases on my website are patients with teeth because they want to take advantage of having their teeth and their bite and their jawline and their profile and their lips and everything else idealized. They want to be the best they can be, and they want it to be natural. So I locate the natural jaw position and build that. It can be done with dentures and implants, but I don't treat denture patients with implants. I let someone else do that.
When I was a young kid, I was clumsy. And so I got hit in the face multiple times catching a ball. which caused one of my front teeth to have to die. The nerve died. What about root canals? There's a whole controversy going on about root canals today in terms of, are they good, are they not good? Is there something else that can be done? And do you work on that?
I do. Basically, I have to take the practical side. I understand the horror stories of root canals, and let's face it, over my 40 years, I've seen it. I've seen horror stories with implants. I've seen, problems with pretty much everything. Patients with healthy teeth. Let's take my daughter, for instance. She has healthy teeth. They just happen to be too small for her anatomical structure. And right now, she's getting them all rebuilt by adding to her teeth rather than grinding them down or rather than cutting her jaw and trying to move her jaw. She doesn't need implants. She just needs teeth that are a little bigger so she can be more comfortable and have facial support, and that's the dentistry that I do.
And also give a prettier look.
Well, my website, when you go to the faceliftdentistry.com website, and I started it many years ago, maybe 20 years ago, and I was showing dramatic changes, like this person with an older person with an older looking face took 10, 15 years off their face. And dentists would look at that and say, that's impossible. You can't do that, because I always say to them that they're right. They can't do that, but I can do that. Then they would say, your photos are they're unbelievable, and we think they're photoshopped. So what I've done is I now video. The last 5 years, I've been videoing the patient before treatment, and I video the patient after treatment. So when you look at the website and there's a black button that says click on the video gallery, you can watch 2 to 3 minute videos of all of these patients before I treated them, telling you what's bothering them. I get headaches, I have migraine headaches, I have neck pain, or my jaw clicks and pops, or I have an overbite, or itty-bitty teeth, or worn down teeth, or I look too old, or whatever it is, and then you're seeing them after. Well, that pretty much ended the criticism on what is really possible, because the results are so unbelievable. It's hard to believe that a face could look that much better, and the only thing you worked on was teeth.
And
that's the part that's hard to believe.
And what's also interesting to me is that you would think that a lot of your patients would be older. There's a video of a young man from 5 years ago.
Yes.
And he still looks great.
Well, it lasts. It lasts. It looks great. It's when you look at his pictures in that video, they're showing before and after pictures, and it was sort of an interesting story, because he came, and when you look at his before pictures, I mean, he had crooked teeth and gum. He needed gum work. He needed a lot, and it got done very quickly. And when he was done, he was so happy. He was so appreciative. He was so gracious, and I hadn't seen him for 5 years, and he called me up and he said he just got a big promotion. He's moving to Chicago, and he lost his night guard. I make custom night guards for each of these patients to wear to hold the teeth in their position, so as you age, they stay where they are and things don't break, and it's solid. He followed all of my instructions on hygiene and everything, and he was concerned about the cost of, I said, look, you fly to California, I'll make you a new night guard for free. He said, that'll cover your costs. And the reason was, I wanted to see him. A lot of patients, I treat them and they go home, they're fine, and I don't see them again. But him, I wanted to see how he did, and he flew in, and we did this video 5 years later of him. And it was great to see him because, as he said in the video, he boxes, he fights, he does, all these things. He's a very athletic guy, and everything has been perfect. He's just, his gums are perfect. He flosses, he brushes, he water picks. I'm happy for him.
Wow. By the way, the The website is faceliftdentistry.com. Dr. Sam Muslin, Muslin, faceliftdentistry.com. Doctor, in our remaining moment or two, can you make me taller and give me blue eyes too at the same time or not?
I kind of focus on what I'm good at.
Okay.
I try not to be a jack of all trades,
Gotcha. How did you develop this in our last couple of moments?
Well, when you look at all your other choices, because everybody that has an underbite or an overbite has been told they have to have years of braces, and no one wants that. And they have to have jaw surgery, which is really risky, that no one wants that. You're going to be out of commission, you're going to be hospitalized, you're going to miss months of work, all of that has to happen, plus all the braces. I've had patients who were coming to me that had jaw surgery and braces and still need the facelift dentistry method because it improved things, but it didn't get them all the way there. And so the idea here is that I'm looking at all the invasive choices. I did the braces. I've done the full mouth reconstructions where they grind your teeth down, and I've done the porcelain veneers where healthy teeth are ground down, and I just thought there had to be a better way. I needed to develop two things. The way to locate your best natural jaw position for your anatomical structure. I've got that figured out with JawTrack. And I had to invent a restoration that could be built over the outside of your teeth and the top side of your teeth where I could get the teeth shaped, angled, and so instead of cutting your jaw, I changed the shapes of your teeth without drilling your teeth down. All of the dental things were painful and required shots and lots of time. Without grinding down your teeth, it's safer, it's faster, and it's way more predictable.
Wow. Doctor, thank you very much. Will you come back and visit us again sometime?
Sure. I thought your questions were great. You covered a lot. The implants, the hygiene, I liked it.
I'm Mark Alyn. This is Late Night Health. Join us, of course, at latenighthealth.com. We'll be back very soon with more.